Thank you for joining us for this OSHA session today. My name is Corey Stem. I'm the Health and Safety Manager here at the college. And I'd like to introduce our speaker for the day. She's an Environmental Health and Safety Project Manager for SafeX. She's a certified safety professional, a certified hazardous materials manager, and has over 15 years experience in the safety field. Please welcome Blair Everett.
Thank you, Corey. Good morning, everyone. Thank you for having me here today. Yes, this is an annual requirement to talk about health and safety once a year. The reason we do that is, number one, it's required by law, and number two, we want to keep this top of mind for all of you as you go about your day-to-day jobs. So I am going to train you today on 2 different standards, and the purpose of this training is so that you can protect yourself, your colleagues, as well as your patients. First of all, we'll start out with the legal background behind these requirements. So you see the 2 standards we're going to talk about today are the bloodborne pathogen standard and the hazard communication standard, which is commonly called HAZCOM. And you see links on the slide to each of the full text of those regulations. So if you were to click on that link, you would get pages and pages of very exciting OSHA regulations. What we will attempt to do today is distill those down into the pieces that matter to you, the pieces that are practical for your jobs. These standards were picked as your safety topics because they are the most frequently violated standards that are cited in dental offices and laboratories across the country. So when inspectors come out, when they visit, these are typically the programs where areas or issues are found. So our objectives today, we're going to talk about the requirements of both the HAZCOM and the bloodborne pathogen standard. And then we're going to talk some specifics about how you do it here at the Ohio State College of Dentistry. So one of the things OSHA requires is that you have a site-specific plan that talks about your details. Where do you find your plan? What are the hazardous tasks that you all may engage through the course of your employment here or your learning here at the university? How do you recognize those tasks when they come up? How do you know you're doing something that could potentially pose some level of danger to you or a patient or a colleague? The plan talks specifically about PPE, personal protective equipment, so the gear that you wear that keeps you safe. When do you know when you need to put PPE on? What types of PPE might be required for different tasks? So we'll talk through that. We'll talk about vaccination information, what's required, and other preventative measures that you can take to keep yourself safe from being exposed to bloodborne pathogens. We will talk about the what if. The what if the bad happens. What if someone is exposed to blood or other potentially infectious substances? What are the steps that you should take to minimize your risk in a situation like that? And then last objective for the day, we will talk through the HAZCOM piece, the hazard communication. So we'll talk about different chemicals and materials used that might pose a hazard, and then how those chemicals are labeled and what a safety data sheet is. Hopefully you all remember from last year, but we will address it just to confirm. So let's start out with hazard communication. OSHA's job and PERP's job, because you all are a public employer, you're technically under PERP and not under OSHA. Those government agencies make it a right for all employees in a workplace to understand and know about the chemicals they work with and how to work with them safely. So the theory here is that knowledge is power, that if you tell people that work with chemicals every day what's dangerous about them and how to keep themselves safe, then they'll have a much more likely chance of being able to do that. So what are your potentially hazardous chemicals? You all use anesthetic agents. So they can be local agents, they can be IV kind of sedation agents. Many of those agents, obviously, they have effect on your patients, right? So they could have an effect on you as well. There are some long-term exposure risks here. Nitrous oxide, for instance, can be a reproductive toxin if there are years of exposure involved and improper controls. So that's why most of you are probably familiar with the controls in place when you're using nitric oxide. You want to have adequate ventilation, you want to have a scavenger system, things like this that are hopefully commonplace in most of your practices. You all also are exposed from time to time, some of you at least, to various cements and resins. These are the things that are used to make dentures and other sorts of orthodontic equipment. One particularly hazardous chemical that goes into some of those cements and resins is called methyl methacrylate. This chemical is fairly toxic to the liver over time and has some other short and long-term health effects. It can be a sensitizer, it's a common allergen if you get it on your skin. So that's one that we want to be careful when we're working with. It's not that every time you work with it, it's going to be dangerous. It's going to pose a hazard to you. It's perfectly possible that if you use all the controls and all the PPE designed to be used with this chemical, that there's no risk whatsoever to you. So today is about informing you what are those risks and how to keep yourself safe. Next, electroplating chemicals. Some of you may be involved in an electroplating process in the lab. If you're doing that, there are commonly fumes in the air as you're heating up chemicals. So you may be exposed to acid vapors or alkaline vapors that are in the air that can pose a hazard to your lungs. Lastly, probably everyone in the room works with some type of sanitizer or disinfectant. I imagine it is the nature of your job to keep things clean. So examples of those might be bleach, aldehydes, phenols, or some type of ammonium compounds. These things tend to be corrosive, which means that they either have a really high pH or a really low pH. And when you get them on your skin, they can burn skin. So in a lot of cases, when we're working with sanitizers and disinfectants, we need to wear PPE and we need to avoid skin contact. Now, those were the primary chemicals. There are also some potentially hazardous metals and other materials that may affect those at the College of Dentistry. So the first one is an amalgam, and as I understand, some of these still contain mercury, some of them do not. Mercury is a heavy metal. It can have toxic long-term effects on your body. Anybody ever seen Alice in Wonderland, that Mad Hatter's disease? Right? That's mercury poisoning in a cartoon sort of state. Next ones, you all work with metals in the casting of dental prosthesis. So examples of metals that may or may not be contained in those are beryllium, cobalt, nickel, and chromium. These can be carcinogens, which means that over a long period of exposure, they can cause cancer. Again, if they're handled safely, a lot less risk of that happening. The last one up here is silica. And silica is a dust, and there's been lots of enforcement priority placed on silica by OSHA in the last 2 years. It's a dust that can be produced by mixing or grinding porcelain. So if you're working in a dry state with porcelain and there's powder flying everywhere, some of that powder or dust that you see in the air might be silica. Exposure to silica causes silicosis, which is an irreparable disease. The other places it can come from would be sandblasting castings, investment materials, and then the shop dust. If anyone is involved in cleaning up, dust off countertops or floors after you're done working in an area like this. So how do we minimize potential for silica risk? We try to work with wet methods, and we think about ventilation in the area where we're working. So anytime you can make a chemical or a powder wet, a lot less chance that it's going to fly around through the air and become embedded in your lungs. The other way is potential use of a respirator. If you're doing some of these dusty tasks that we know can pose a health effect, it may be appropriate to wear a respirator. So I've thrown in a couple case studies to talk about just as we go through this. I think it's important to keep it applicable to you. So although exposures to bloodborne pathogens and other health effects are fairly rare in the dental field, I was able to find a couple real-life examples of folks that have been affected either by chemicals in the workplace or by bloodborne pathogen incidents. So our first one has to do with a 53-year-old female lab technician, worked in a dental lab. Her duties were sandblasting beryllium alloys, cutting metal sprue from the alloy with a handheld grinder, removing the bubbles with a handheld grinder and deburrer, and then cleaning up with a shop vac, just sucking up the dust when she was done in that work area. Hopefully this sounds a little bit like somebody's job in the room. I'm hoping there are 200 of you, right? So the tech in this particular situation did not know that beryllium was present in the alloy. Beryllium isn't present in all alloys. One way she could have known that would have been checking what's called the safety data sheet, the reference for that particular material, and would have found out that beryllium was present. But in this case, it didn't happen. The tech also did not understand the health effects of beryllium. She was experiencing symptoms, and these symptoms persisted over a period of 5 to 7 years. She thought it was a cold. She had low energy, she was tired, you know, which among us has not been tired and had a cough from time to time. But this cough became persistent. She had shortness of breath, and finally, she saw a doctor about it and was misdiagnosed 3 times. 3 years later, she was finally diagnosed with something called chronic beryllium disease after working in the field for 13 years. So an example like this, we hope that it all could have been prevented by better information being available, better PPE, better controls, better ventilation, better systems in place to prevent the hazard. But unfortunately, this case, one of the rare ones, did have a negative impact on this woman's life long term. Okay, let's talk about OSHA's hazard communication standard a little bit. There are a few different things that are required under this standard. The first is labeling of chemicals. So if you've got a right to know what you work with, one means that you have available to you to figure out the hazards of what you're working with is the label on the outside of the package. So if you're working with something that comes labeled direct from the manufacturer, it's going to have a label with tons of information on it. And we're going to look at a label coming up on the next slide. Anyone ever take a chemical that comes from the manufacturer and put it into smaller bottles, maybe dilute it a little bit for use in the lab or use in a patient setting? If that's the case, you all have the responsibility to then label what's called the secondary container. What we don't want to see when we go in, you know, other clients, we go in on inspections and we look around work areas. We don't want to see an instance where there's a bottle of something clear. And we're all wondering, is that my water bottle? Or is that some type of toxic substance? So labeling is very important. Labeling gives us clues as to the physical and the health hazards associated with that material. The next thing that the HAZCOM standard requires is something called a pictogram. And if you look over in this graphic, see how there are red bordered diamonds there? These are pictograms, and the purpose is to explain, you know, to those that may be young children or have some language barriers, what is the basic hazard about this chemical? What is the most important thing I need to know to keep myself safe around that chemical? And some are more descriptive than others. You know, my 3-year-old knows when he sees a skull and crossbones on something underneath the bathroom sink that that's bad, right? So that's an example of a very descriptive pictogram. Gets the message across without any need to read. The next thing the HAZCOM standard requires is a safety data sheet. So this is the specific reference document that's going to come to you with each chemical that you order. So the first time you order a chemical from a supplier, the manufacturer or the supplier of that chemical is required to send what's called an SDS, a safety data sheet. And you'll notice, if you're someone who looks at these periodically, that the format has changed over the past 8 years or so. It used to be that they all varied in length and they all had different information and you never really knew what you were going to find on one. But OSHA has dictated the format, and there are 16 sections. They're all going to be in the same order. The types of information you find on it are very broad and very diverse. It'll tell you what PPE you need to wear with that chemical. It'll give you advice on waste handling. Is it something I can flush down the drain, or is it something I need to specially dispose of as hazardous waste? It will also give you exposure limits. If OSHA has established limits that are safe to be exposed to, they'll be published on this safety data sheet, so you have an idea of how much of it you can safely handle without putting yourself in danger. The next part of the hazard communication standard is personal protective equipment. And OSHA requires employers, like the College of Dentistry, to have information available on task-specific PPE guidance. And you all have this in your plan. For certain tasks, it dictates what type of PPE is appropriate. You all may perform a procedure one day that requires a full face shield, and another one that only requires safety goggles. And the next day, perform a procedure that doesn't require any protective eyewear at all. So the details of that are found in your exposure control plan. So this is an example of what's called a globally harmonized standard label. So what you see up at the top here is going to be the name of the chemical. That's important because if you want to look it up in your MSDS system that you have available to you online, you could search by the name of the chemical or many other pieces of information. Next thing you see is a pictogram. So here's our skull and crossbones. Don't drink it, it's toxic, right? Here next we have what's called a signal word under OSHA. So we have two choices for this signal word. You can have danger or you can have caution. Danger indicates just that, a higher level of risk than caution does. Then you have some precautionary statements. So it's going to give you information. Fatal if swallowed, causes skin irritation. And as it gets down on the label, it gets to more of the detailed information. Advice on what sorts of PPE to wear, wash your hands after handling in it, what to do if you get it on your skin. It also gives you the material's manufacturer contact information in case you needed to reach out for them for any more detailed information. OSHA puts chemicals in categories to give you an idea of the severity of the hazards associated with that chemical. So this is just one example category, and this is an example for chemicals that might have acute oral toxicity. So that means when you drink it, it's going to hurt you quickly. So the four categories that you see here are, starting with category 4, it says it's harmful if swallowed. Category 3 says it's toxic if swallowed, so more serious. Categories 1 and 2 say fatal if swallowed. So it's just a bit of guidance to you so you can compare relative risks of chemicals. If you're the one in charge of purchasing chemical supplies for your lab or for your practice, your clinic, you may be able to do a little bit of cost-benefit comparison here and think, well, these two chemicals do the same job. Could I use the one that's slightly less toxic rather than the one that's going to pose more of a hazard? You will note, if any of you are familiar with some other chemical classification systems, that the categories here seem backwards to some people. So in this example, category 4 is less dangerous than category 1. So just kind of keep that in mind as you're doing your comparisons. You all have a fantastic SDS, Safety Data Sheet Retrieval System, and it's available online, so no matter where you're working, on campus or even at home. I assume you all can access this at home. Corey's nodding yes. So you can search by the name of the chemical, the manufacturer of the chemical, other criteria that you may have available to you. So if there's an emergency, this is a great place to get your hands on a resource very quickly. All right, so pop quiz. Think about this one in your head just for a minute. Which of the following piece of information can you find on a safety data sheet? The correct answer is the first 4 pieces of information are available on a safety data sheet. You will not find the phone number for your local fire department, and you will not find product usage instructions. Typically, product usage instructions are going to come along with a label associated with the product or the chemical, not the safety data sheet. So it's really just that health effect information, technical data on the chemical. Moving on to our next topic, this is personal protective equipment. So PPE should be worn during all stages of your job in most cases, and that includes housekeeping and cleanup duties. We saw that earlier example, the woman with the chronic beryllium disease. The doctors thought that a lot of her exposure actually happened after the actual task was over, and she was tasked with sweeping up, mopping up, taking out the trash. So minimum PPE for the College of Dentistry includes protective clothing, which is a standard disposable clinic gown, protective eyewear, and gloves. All right, we are moving on to our second topic, which is the bloodborne pathogen standard. So let's start with a quick definition. A bloodborne pathogen is an infectious microorganism found in human blood that can cause disease. There are many examples of these. The ones most commonly mentioned in dental industry-specific research are hepatitis A, B, and C, and then HIV, which is the virus that causes AIDS. And these are mentioned because there have been some contracted cases. Very few and far between, but there have been contracted cases of those 3 diseases between dentist and patient, patient and dentist, or patient-to-patient transmission. Those 3 are also kind of top of mind as we have this topic because they are diseases that are chronic. They're diseases you're going to live with for life if you are so unlucky as to contract them. So as dental personnel, you're at risk because the normal part of doing your job. So this standard applies to folks that have some risk of likely exposure. That includes students, faculty, lab personnel. College of Dentistry has made, a conservative decision to involve even students in that approach, although OSHA would not regulate a student's exposure. So the primary ones of concern are up there for your reference. So when we talk about how these diseases are contracted between people, they can be transmitted through mucous membranes, an airborne pathway, so breathing on someone, or a break in the skin. So OSHA has some primary modes of transition or exposure. The first one of those is inhalation, which means you can breathe in the disease. The next is injection. And in the dental field, you all work with a lot of sharp things, right? So injection is a pretty common pathway, whether it's by needle or if it's the OSHA standard, they call it a sharp. We can also get affected through skin absorption, which is when splashes happen. And splashes that happen to the eyes and mucous membranes actually have a much higher possibility of transmission than splashes that happen to unbroken skin. But either way, PPE prevents that transmission because it acts as a barrier, assuming it's in good condition. We can also transmit disease from an aerosol spray, from handpieces and scalers if you're inhaling the mist. Any breaks in your skin make transmission all the more likely. So if you're walking around in December in Columbus and you have chapped, dry hands like most of us do right now, if you've got some breaks in your skin, it's especially important to be wearing gloves to prevent the transmission of disease. So let's talk just for a minute about the chain of infection. You need 3 different things to actually have transmission of a disease. The first is the infectious agent itself. So that can be the bacteria, the fungi. Mostly in your case, it's going to be a virus. So there has to be a source, and that source has to be a high enough quantity that it's actually possible to transmit the disease. The next is there have to be the means of transmission. So that's when we talk about our inhalation, our injection, our absorption. And then the last is there has to be a I cannot say that word today, susceptible host. So this is where the infectious agent will transmit to. So it's going from the source to the host. If you don't have all 3 of those things, you don't have transmission of an infection. So what we're trying to do through all these controls we're talking about today, our PPE and our engineering controls, is we're trying to break this chain. We're trying to eliminate one of those things to prevent the infection from occurring. So where do you all see bloodborne pathogens in your operation? These are just a couple examples, certainly not limited to the things you see up there on the screen. But all those sources are places where you are likely to find bloodborne pathogens in your day-to-day work. All right, this next case study has to do with a hepatitis B transmission that was that occurred at a free dental clinic in 2013. This was quite a large incident. They actually ended up, once the case of hepatitis B was reported, they screened 1,500 people for bloodborne diseases, and that included all the staff at the clinic that day, all the patients that had visited this temporary free clinic that day. And of those 1,500 people, they discovered there were 3 possible source patients. They did interviews with many of those 1,500, and they observed or heard about improper sterilization of instruments at this clinic, but they never found a conclusive evidence or definitive link to what caused this transmission. Never narrowed down the specific piece of equipment. There were 5 cases that ended up out of this incident. 3 of them were patients and 2 of them were staff members. Interestingly enough, they were not healthcare providers that were the staff that contracted hepatitis B. They were the staff who were setting up the supplies and then performing the maintenance and sterilization functions at this clinic. So like I said, these incidents are not common. I had to dig really deep on CDC's website to find these. But they are out there, and they are unfortunate because, again, I think we're talking about something that's very preventable in this case. So OSHA's standard requires the College of Dentistry to have something called an exposure control plan, and you do. It includes the elements required by law, which are the standard and universal precautions, the engineering and work practice controls. So we talk about engineering and work practice controls. That's something like sterilization would fall into that work practice control category. Personal protective equipment, there's a section in there that talks about housekeeping and waste handling. Labeling of materials, whether that's your system at your clinic for telling whether something is clean or dirty, or labeling chemicals themselves. It also addresses record keeping and training requirements. So the bloodborne pathogen standard requires that you all use something called standard precautions or administrative controls. And that is to always assume that body fluids are infectious. So even if you are working on, let's say, your spouse as a patient, you think you know everything about your spouse, right? We're not going to treat that patient any differently than we would treat any other patient where we suspect maybe there is a disease. Or sometimes I'm guessing the patient actually tells us there's a disease involved. But no matter who the patient is, we're going to assume that any body fluid, not just blood, can potentially be infectious. And we'll treat all potentially infectious materials, whether that's contaminated gauze or a glove or a bridge that's come out of someone's mouth or a flosser, as if they are indeed infectious. You all are empowered to speak up when you see or hear about issues through the course of your job. So the plan is for you to report immediately to the supervisor, the clinic director, or the Office of Clinic Administration if you suspect that these standard precautions are being violated or that someone is creating a risk in the workplace that could impact your health or the health of the patients you serve. One of the best ways to prevent the spread of disease is through immunizations. So all College of Dentistry employees, including students, which again is really awesome and proactive, they are required to receive the following vaccinations and screenings. So those should look very familiar to you. And as I understand it, there's a way to opt out of the annual flu shot if you complete a form and agree that there's some risk in you opting out of that. The rest are non-mandatory. The hepatitis B, MMR, Tdap, varicella, and influenza, along with TB testing, is provided at no charge to you. So it's like you're getting a free physical, courtesy of your employer. How many people can say that anymore? You all have a chart in your exposure control plan that talks about your own medical conditions that may trigger restrictions in working with patients or having patient contact. So depending on what your disease or condition is on any given day, you may be restricted. So for instance, you have pink eye, you cannot have patient contact until the discharge ceases. You'll see if you look through this chart that some of the restrictions are shorter or longer than others, and some may actually be on a case-by-case basis, such as hepatitis B. So you should speak up about your own medical conditions so that you're not putting others in danger. Because like we said earlier, transmission can come from the dental provider to the patient as well. Next, we're going to talk about engineering controls. So this is a way that technology can keep us safe. And it seems like, in my research, that the dental field has come a long way in preventing cuts and injuries in the last 20 or 30 years. This example that you see a picture of up on your screen is called a blade safe. And its purpose is to remove the scalpel blades from the handles and to do it in a safe way. So this particular device can help you prevent cuts and injuries in the workplace, particularly because lots of these blades may already be contaminated with blood or other bodily fluids. The next example of an engineering control is called a protector. And this is a way to get the needle off of the syringe without exposing yourself to it. I'm seeing these more and more in practice. Hopefully you all are too. It is a requirement of the College of Dentistry to use these to minimize your risk. All right, next we have some work practice controls. So after you use those scalpel blades or those needles that we just talked about, they go into a red plastic container that's labeled with the biohazard label like you see up there on the screen. That is to prevent injury to someone else who may inadvertently take out the trash if it's in a trash bag, for instance. They're puncture-resistant containers, and they are always closed and locked without you doing anything special to them, so they make it really easy. A couple other rules to review here as it comes to handling sharp objects. We never want to recap a contaminated needle using both hands, and we wouldn't point the needle directly towards our body as we're handling it. Never bend or break a needle prior to disposal. Seems like common sense, right? We would always recap a needle using the one-handed scoop technique. And then we would use verbal alerts and remain aware of surroundings when moving sharps. Do you all ever work in crowded environments where there may be somebody right behind you without you really realizing it? I can imagine so. So it's important to let people know when you are on the move with something sharp in your hand. Next item is the removal of PPE. So this watch that this woman is wearing in the picture needs to come off before she puts on her gloves, first of all, right? It can trap bacteria, it can aid in the transition of disease if we're wearing jewelry or watches in the workplace. We also want to remove the PPE before we leave the treatment or the work area, so we're not carrying those germs out to another area of the facility. Eating, drinking, smoking, and putting on any sort of cosmetic or chapstick in the work area is prohibited because it's another route of transmission, is ingestion. We would never intentionally, take a soiled glove and put it in our mouths, but it's basically the same as doing that. If you've just touched something soiled and then you go to put on your lip balm or smoke your cigarette, then you're transmitting through ingestion. Fingernails are another source of potentially trapping bacteria and increasing the likelihood of disease. Work practice controls also include hand washing, and Center for Disease Control has come out and given very specific guidance on how to wash your hands, how long you should wash, the patterns in which you should wash. Hand washing is known to be better than using hand sanitizer, although we understand there's a time and a place for that too. It should be used in conjunction with hand washing with soap. You want to wash your hands before you put on your PPE, including your gloves, because if we're touching PPE with our dirty hands, then we've now contaminated it. We also want to wash our hands immediately after we take the gloves off or immediately after exposure. Alcohol-based hand sanitizers, may be used, but they don't replace hand washing. If you see visible contamination on your hands, then sanitizer is not going to do anything to help you get rid of that. We have to use soap and water, like the old days. College of Dentistry personnel are encouraged to wear appropriate PPE for the particular activity for which they are engaged. So you all have a flexible model, which is great. You all are professionals. You can gauge the situation and, using guidance from this exposure control plan, decide what PPE is suitable for that particular task that you're about to engage in. PPE is also required during laboratory procedures if there's likely to be contact with contaminated materials. So OSHA has this model called the hierarchy of controls. And what they say in this model is that you should start at the top and you should work down when it comes to controlling hazards in your workplace. So the first thing you should try to think about is elimination. Is there a way we can eliminate this task altogether? And in your case, very often there's not. People need dental care. They need you all. So then we move down the chain to substitution. Is there a different substitute we could put in place? Maybe it's an amalgam that doesn't contain mercury. Maybe it's using a sanitizer that's slightly less toxic than one you were buying 5 years ago. Next, if we cannot engineer out the hazard entirely, we're going to move on to engineering controls. And that's where we look at things like ventilation and the design of your workspace. If that is not achievable in eliminating the hazard, then we move to administrative controls. These are procedures that are intended to keep you safe. The use of a sharps container, for instance, would fall into that category. SOPs for sanitizing your tools and instruments and equipment would fall in that category. And then the last thing we're supposed to consider as a hazard control is PPE, personal protective equipment. And the reason it's at the bottom is because OSHA realizes we're all human. And humans sometimes are inherently unreliable, right? We sometimes forget things, what we had for breakfast this morning, or to put on our gloves, or to wash our hands. So it's at the bottom of the chain because it's sort of a last resort that we should consider once all these other things have been considered to eliminate the hazard. Not that it's not important, just that we have to consider the whole picture of whether we can reduce the potential. So what is your PPE? In terms of a mask, it is a fitted ASTM level 2 mask. It should be worn during procedures where you are likely to suspect splashing or splattering of blood. You would change your mask between patients or if the mask becomes soiled during a procedure with a single patient. Remove your gloves first when changing the masks. You wouldn't adjust your mask on your face with gloved hands. Next comes safety glasses or face shields. The picture that you see on the screen, you notice that these are not regular reading glasses. These have side shields on the sides. So even if splattering comes in at an angle on the sides, it will protect you from getting that in your eyes. These should be worn during procedures that are likely to generate splatters or sprays, again, or patient care and lab activities that might produce debris. Again, you would disinfect it between patients. I know my dentist's office has a clean and dirty bin right in the room, but you also may disinfect on the spot. And then you would wash your hands before removing. In terms of clothing, we have disposable gowns that are worn during all patient clinic procedures. The order of putting these on is important, right? Because we are trying to prevent liquids from getting in on our skin. So the sleeves should cover the forearms and the gloves should be overlapping the sleeves. We should change it, again, for the last two, it's the same. When it's visibly soiled or penetrated by blood or body fluids and in between patients. Remove before leaving the clinical and lab areas, and then we don't wear it if we go to lunch or to the restroom or out to greet a patient in the lobby. Other types of PPE that apply in certain areas, surgical caps would be worn in the sterilization and surgical areas. Closed-toed shoes are in clinic and laboratory areas, and then shoe covers are in the sterilization and surgical areas. The gloves that you have available to you, there are 3 different kinds. They're appropriate and specific to the task that you're using them for. So the first type is surgical gloves. These are sterile gloves worn during oral surgery procedures. The exam gloves are basic patient care and basic laboratory procedures. So I'm guessing these are our kind of standard issue. These are the ones we wear the most, right? And then utility gloves are going to have some puncture resistance to them. Sometimes they are leather or made out of a thicker material. And these are designed for situations where you're handling sharps or chemicals. If you were wearing exam gloves and a needle touched your skin, would those exam gloves offer any type of protection? Not at all. Needles go right through those things. So the utility gloves are important if we're expecting to be handling something sharp. You don't wear your gloves when you're touching patient charts or other documents. And then wearing gloves does not get you out of hand washing. The CDC says you still have to wash your hands, even if you're fantastic about wearing your gloves 100% of the time. So gloves are intended for single procedure, single patient use. You'll change them between patients or when they're heavily soiled. Also when they're punctured or torn. Gloves should be removed using glove-to-glove or skin-to-skin technique. So what this means is I am not going to take the contaminated glove and grab it with my bare hand. I'm going to use my gloved hand to pull that one back. And then you want to overlap the sleeve, again, trying not to leave a gap between your gown and your glove. You all have some detailed procedures in your exposure control plan for how to put on PPE. There's an order to it. And I think by following these procedures, you eliminate some of the risk that can come from tearing the PPE or making sure everything is settled and adjusted properly before you enter the treatment area. So I'm not going to go through it in detail, but they're in there for your reference. You all have a matrix in your plan of how to clean and disinfect different pieces of instruments. So depending on what category the instrument fits into, whether it's critical, semi-critical, non-critical, or disposable, this table gives you some advice on, first of all, what fits into each category, and then the method of sterilization that is appropriate. And you'll see that everything critical has to be heat sterilized after every use. Everything semi-critical, it's preferred you heat sterilize it, but you can also do cold sterilization. And then non-critical, we're doing intermediate, low-level disinfection or basic cleaning. And then you all do have many things that are disposable and intended for one-time use. It is a problem if you are trying to sterilize things that are intended for one-time use. We've had some clients say, I'm going to save money and I'm going to reuse those gloves. Not a good idea. The College of Dentistry can afford more gloves. Throw them away if they are intended to be thrown away. Okay, our third case study, it's another transmission of hepatitis B. This one occurred in 2002, and it was at a dental surgery center. The patient was undergoing 3 extractions during his visit to the clinic that day, and he had a high virus load case of chronic hepatitis B. The staff followed all the practices that they should have practiced to prevent infection as it related to PPE and vaccination. So they were wearing their gloves and their masks and their gowns and their goggles, and they were properly vaccinated. And the problem was with the cleaning practices. So there was a lapse in the environmental cleaning practice. Sometime after the source patient was treated, there was a little puddle of blood left behind. The area was contaminated with blood. No one noticed. I'm sure that people get busy in your profession, and in this particular case, the puddle of blood went unnoticed, and other patients entered that same treatment area. In this particular case, after it was reported, they screened all 27 patients who had been in that area through the course of the day, and luckily only 1 actual infection resulted. But you can imagine the headache and the drama that goes into cases like these. It would be quite the nightmare to be involved in a situation like this, I think. So another way we prevent situations like that is through the utilization of barriers. Surfaces that can be contaminated by blood or other potentially infectious materials are going to be wrapped with a plastic barrier in your clinic areas. Anytime you're touching the barrier, you're supposed to use gloves to remove and replace it. So you see examples of different things that should be wrapped in plastic there. Hopefully it's all very familiar. When it's time to get new PPE, you have a housekeeping and laundering service that is available to you so that you don't have to wear your dirty PPE home and wash it in the same washing machine that your family is using. So we're preventing the spread of disease just by keeping it at work. Contaminated dirty linens are placed in dirty linen carts, which are located outside the Instrument Management Services Department. That dirty linen gets collected and professionally laundered through a contracted vendor, so you would never take it home. If you ever notice any issues in this area, maybe you see something leaking out of the cart, you notice something that's a problem, please bring that to the attention of the building's custodial staff. The College of Dentistry also has procedures in place to dispose of medical waste. There are 2 different categories of medical waste, regulated and non-regulated medical waste. And you all have an expert here that helps you figure out what's regulated and what's not regulated. But some examples of regulated waste would include extracted teeth, sharps, excised tissues, and materials that are soaked or saturated with blood, bodily fluids, or potentially infectious material. So I always tell people, if you have a paper cut and you put a Band-Aid on it, that's not regulated medical waste when you go to throw away that Band-Aid. That can go in the trash. But if it's saturated or soaked, it's regulated medical waste. Sharps go into those plastic puncture-resistant containers that we saw a picture of earlier. But the rest of the medical waste goes into labeled bags that look just like this. They say biohazard on the outside. Hopefully you all know where to find them and what goes in them. There are some standard operating procedures related to waste disposal. One of those is for biohazardous waste. And then for those of you work in environments with chemicals where you're having to dispose of those amalgams or the methyl methacrylate or the liquid sanitizers and bleaches that we talked about earlier, there are procedures for both solid chemical waste and liquid chemical waste as well. And these are available to you on the Health and Safety section of the College of Dentistry's webpage. So now let's talk about the what if, the stuff we never hope happens. There is a SOP available for blood and body fluid exposure. So if this were to happen when you were working, what you would do is you'd immediately stop the procedure, isolate the involved instrument or needle. You would wash the affected area, whether it's an affected area on your body or the patient's body, with soap and water, and you'd cover it with a bandage. So those are your most immediate actions. After those are taken care of, then you would make notifications. You would let your supervisor or the supervising faculty member know in that particular situation. The injured individual and the source patient, so the person that we expect might have had their body fluids or their blood on that particular instrument, would be taken to the oral surgery clinic. If it's closed, then you would go to the emergency department. There's a specific incident report form that the College of Dentistry would like you to use in situations like this, and you can find it on the clinic administration webpage under Health, Safety, Compliance, and Training. This flowchart, hopefully it's posted all around and is very familiar, but it basically just walks through what we talked about. First things first is we're doing wound care. We're taking care of the patient. Next, we're making notifications. And then we are going to take them to either the oral surgery center or the ER, and we will work to obtain written consent to test the source patient or the source individual for those diseases of concern, those bloodborne diseases that we're worried about, the HIV, hepatitis B, and hepatitis C. So we have a hypothetical exposure for you to talk through. Just spend maybe 2 minutes talking to the person next to you about how you would approach this. The scenario is you're the healthcare professional. You are performing a procedure on a patient, and you are cut by a burr. This burr has previously been inside the patient's mouth. And the healthcare professional, you have a laceration on your right hand as a result. So in your specific clinic, get into who would I report this to? What are my immediate actions? And then what action would I take for the future? Is there anything I can do in terms of PPE, engineering control to prevent something like this from happening in the first place in my area of work? So just take 2 minutes to discuss. I think we've addressed pretty well what are the immediate actions. We would start with wound care, flushing the area with soap and water, flushing any exposed mucous membrane, so eyes, mouth, in an eye wash, something like that. Next, we would make notifications, supervising faculty member or the clinic director. We would take the patient to the medical center or emergency room. After that, I'm most interested in your thoughts on preventative and corrective actions for the future. I know you all are a big group, but is anyone willing to share a preventive or corrective action they thought of as a result of this laceration? You guys work with burrs every day, some of you, right? What do we do to keep ourselves safe? They're sharp. Yes, sir. Put a cup over the burr. Fantastic. Is that a common practice? I see some head nodding. Okay, great. Another one?
You take the burr out and put it back in the burr block.
Put it back in the burr block. Yeah, that's a great one. Good, so just having those sharp objects around the workplace, there are ways to minimize the potential for danger associated with them. Excellent, thank you all. So our accident and incident response protocol can be found in an SOP within this document that we've been talking about. Tends to be when an emergency happens that your adrenaline's pumping and you can't remember exactly what you learned in this class, which maybe was 12 months ago for some of you. So know that you've got this handy reference there if there's ever an emergency. It'll walk you through step by step what you need to do. And this is a screenshot of the health and safety section of the College of Dentistry's website. Here you can find all the helpful links for things we've talked about today, as well as access to the regulations and the written exposure control plan that we've been talking through the details of today. If you all have follow-up